My name is Jakub Sikora, MD. I'm an orthopedic spine surgeon. For fun, I like to go outdoors, spend time with my family. I mean, skiing, hiking, traveling. We travel a lot as a family, kind of see the world and different cultures. So I have a pretty unique background. My parents are Polish. My whole family's in Poland. I grew up going there every summer for months on end. It was free childcare for my parents. We came to the U.S. when I was about a year old, and I've lived all throughout Michigan, California, Texas, and now Salt Lake City. So I've been able to treat everyone from Navy SEALs to professional athletes to oil workers to very difficult deformities really throughout my whole training. So I think I've been to like 30 plus countries, so I've been exposed to lots of different cultures. So I really think that my strong suit is being able to relate to everyone, no matter what your background. My wife and I have one daughter. She's a blessing. She's just wonderful. And we're hoping to have more children, but they're just a fun time. I chose to become a doctor because I just wasn't that good at sports. I always thought growing up I'd be a professional athlete or something really active, but then reality hit me in the face. I got good grades, and ultimately my mom was a physical therapist, so I think that really pushed me to become a physician. I chose orthopedics because it's exactly just helping lifestyles, and then spine just because it's so intricate and probably the foundation of the human body. So it's really been a wonderful trip. So my mom, growing up, had this encyclopedia of horrible, horrible illnesses, deformities, all that stuff. So I remember growing up reading it and being like, wow, it's fascinating. So I wanted to be part of that solution instead of the problem, and it led one thing to another, and now I'm doing orthopedic spine. That's awesome. So I always imagined myself as doing sports medicine, but then I worked with Dr. Garfin and Dr. Allen at UC San Diego, which is this preeminent Southern California spine practice, and they do a lot of revision and scoliosis as well as basic discectomies and stuff, and that's where I learned how important good spine care is. A lot of patients, if they're having back issues, it's completely life-limiting, and so being able to help them and push them in the right direction, it opened my eyes, and it was no question after I did that. My patient care philosophy is centered around treating everyone. I want to be ingrained in the community. I think being a vital and important member of the area and being able to go to the grocery store and see patients doing well and being like, how are you doing? I want to bump into my patients, see how they're doing, making sure they're doing well, doing everything they want to do and need to do. I want my patients to know that I'm always putting their care first, whether it's recommending them for injections or therapy or some sort of exercise program, not necessarily surgery all the time, but that we're going to get to the best option for them and get them moving forward, no matter what it is.